Good. So the title of the unit is International Healthcare Policy. So that means that we will look at our national policy and look at other policies outside the UK. And anybody who is a national from other countries joining this broadcast will also have to try and then look at their national policy and probably compare it with the national policy of UK, and we'll see how things go. Right. So the aim of the presentation is to explore the international context of healthcare policy and organization of healthcare. And then we try to understand contemporary issues and promotion of public health. And then we'll also try and look at the political, social, and cultural issues that help to determine healthcare policy. So if you look at healthcare policy across the globe, they are different because people have got different political, social, and cultural issues that actually determine healthcare policy of that very country. I will also try and then assess the policies and practice in one specific context. We'll use one national context to explore further. Right. So we have 1, 2, 3, 4 aims to achieve. We wouldn't be able to finish all today, but we'll try as much as we can to achieve the learning outcomes and then assessment criteria that will help us do the assignment. And then we'll try, the assignment is already on Moodle. I will have time to go through the assignment with you as well and look at the indicative content of the course so that you will know where we have covered and what else is left for us to do. Right. So let's look at the next slide. Having a look at our aims and objectives. Let's look at the next slide. There are 3 main learning outcomes here. 3 main learning outcomes. Understand the healthcare policy formation in an international context. Understand the social context of healthcare, and then understand the healthcare provision. Right. Let's look at the next slide. Now, we may ask ourselves, what is health policy? We're trying to look at international healthcare policy. So number one, we need to understand what a health policy is at all. In fact, policies are documents. If you go to any workplace, they can tell you, oh, we've got a health and safety policy. It's a document that you have to follow. Or we've got a policy on safeguarding. It's a policy. So for a country, there is the need to have what? A healthcare policy. And if you look at policy of different countries, they are all different because every country has got specific needs that needs to be addressed. I don't think malaria is a problem in the UK because we don't have mosquitoes here. So if you look at the health policy in Bangladesh or Pakistan or in Nigeria or in Brazil, it's different because they have got different issues altogether. So what is in their policy document is going to be different in what is in our policy document in the UK. So healthcare policy can be defined as decisions, plans, and actions that are undertaken to achieve specific healthcare goals within a society. This is a broad definition by World Health Organization. So we might have a health policy that focuses so much on cardiovascular disease, which are problems in the developed countries. That might not be a problem for other countries in sub-Saharan Africa or somewhere else. So there are a health policy is simply defined as decisions, plans, and actions that are undertaken to achieve specific health goals within a society. Now in the UK, we've got issues on obesity and people not being active, and that being the problem. We've got knife crime in London. So you could see that we might have a health policy that addresses all those issues. But if those issues are not problems in other countries, they will have a different policy altogether. So it's just decisions, plans, and actions that are undertaken to achieve specific healthcare goals within the society. So according to the World Health Organization, an explicit health policy can achieve several things, and it defines the vision for the future. It outlines priorities and the expected roles of different groups, and it builds consensus and informs people.
I'm going to have to interrupt. I'm terribly sorry, but the presentation you're giving me isn't the presentation that I've downloaded. And I've got 4 aims to do for international healthcare policy, not 3.
Okay. If you look at the aims and objectives that I showed in the first screen, there were 4 aims and objectives I want to achieve. If I go back on the screen, you see I've got. I gave out 4 main aims and objectives.
Yeah, okay. And am I doing session 1 LO1, understanding healthcare policy formation in an international context? Because none of the slides that you're showing me is what I've got printed here.
Yeah.
Yeah.
All right.
So can you see that?
Yeah, I can see. I can see that. I can see that. It's all covered in what we are doing, right?
Okay.
I'll show where all the learning outcomes are.
Okay.
Right. So the first place we need to understand what policy is, and that is what I've been describing in this slide. So countries around the globe formulate their healthcare policies in line with the objectives of the Millennium Development Goals. The Millennium Development Goals are things that was set by the World Health Organization. And it covers the whole world. Eradication of some diseases, provision of food for all, eradication of polio, provision of potable drinking water for all. So if you look at the Millennium Development Goals, so comprehensive, it covers everything. Food security, health, everything. So that is a guide to support every country to be able to tap their policy from the Millennium Development Goals. So if you look at policy of every country, it reflects the general global agenda. Even though something like polio is not a problem in the developed countries, the Millennium Development Goal has captured all that into perspectives. So if you see that polio is your problem, then you will formulate your policies to make sure you eradicate that. So all that we are doing, the health policies of the whole world, is just within the framework of the Millennium Development Goals that was set by the UN. So this slide has actually highlighted what a policy is. It's a document, and it contains plans, decisions, and actions that are geared towards specific healthcare goals. Right. So let's look at the next slide that follows. Healthcare policy formation, international context. Right. We have different approaches. We have national health services. We have private health services. We have local and national organizations, and the national priorities. So if we look at the approaches, the approach in the UK here is more or less the free healthcare for all, and that is what the NHS stands for. So it's a different approach in the UK. If you go to America, it's a different approach altogether, because that one is based upon insurance coverage. If you are not covered with insurance, you don't have any access to healthcare. You have got a different approach. Different countries have got different approaches. Some have both the private and then the national one running side by side. And we have different national health services across the globe, providing different services to the population. We have private health services alongside the national ones. Even in the UK here, we have private healthcare. So anybody who wants to go private can go. But we have the National Health Service, which is free at the point of delivery once you are a resident in the UK. But it's also got the private health service running alongside it. If you go to America, it's all paid for. So there's nothing like free national health service that you can go into. Right. And then we have local and national organizations that support the health service. In UK, you have a lot of charities. We have NGOs, which are local, some are international. If you look at the Cancer Research UK, it's an organization within the UK. They all feed into the national health delivery. We have a Red Cross, we have Bernardo's, so many organizations are involved in the healthcare delivery. So we have the national one, we have the private ones, and so many local organizations involved. And at the same time, every country has got national priorities that is set within their healthcare policy. As I said earlier on, the issue of obesity is an issue in the UK because a greater percentage of the young population have that problem, and it's going to lead into bigger problems once they grow old. Other countries don't have that as a problem because people think about what they can, how they can get 3 square meals a day. So in that case, they don't think obesity is a problem, so it wouldn't be their national priority. If you go to somewhere like Zimbabwe and South Africa, their national priority in healthcare is all about the control of malaria and HIV/AIDS. I mean, that is their priority. If you go to Pakistan and Bangladesh, their national priority is all about dengue fever. That is their problem. So they have national priorities. If you go to Brazil and part of Latin America, they have issues with the Zika virus, which was all over the place, causing women to give a child to baby with deformities and the rest. Zika is not a problem here, so that wouldn't be our national priority. If you go to America, they have similar priority compared to the UK because it's a developed country. So every country has got a national priority. So healthcare policies are different with different priorities based upon the health of the population. So we have to get this broad view of healthcare policy formation in an international context. So the UN World Health Organization has a general framework which is expressed in the Millennium Development Goals. But apart from that, every country has got specific problems. So they have different national priorities. Let's go to the next slide. What about funding? Funding. There are different funding models which I have more or less described. We have public funding, which the NHS is number one and a living example. We have private funding from people's pocket, and the US is an example. We have the charitable funding, where some funding comes from charitable organizations. And then some countries have mixed funding. We've got partly funded by the government and others by individuals. We've also got non-governmental organizations who are involved in the provision of funding. Some NGOs will come in and then provide funding. And I can say that the Red Cross, the charitable ones, that the Cancer Research UK, they are all charitable organizations. They are not there to make money. In a way, they also provide funding. They also do provide funding. Right. So there are, in terms of funding, there are different funding modes that is open to different countries. Every policy that is brought about needs to get funding, because without funding, policies don't work. So this slide is trying to let us understand different modes of funding with classical examples. And then if you look at the UK, which I can't say much about, is basically public funded from national insurance, taxation. So anybody who is resident in the UK here is qualified to get free funding. America is a classical example of private funding, where individuals have to pay for insurance before they can access it. We have charitable fundings that, in a way, sometimes apply in the UK as well. So our model in the UK is public funding. However, if you choose not to go the NHS way, you want to access private healthcare, fine, you can have it. So it's there. But the major funding stream is from the government treasury through the Department of Health. So it's public funded organization. So all our policies are funded publicly. So these are different funding models across the globe. Right. So we need to take a note of that, because it will be relevant for us to look at different funding models and the problems associated with them in terms of implementing our policies. Because without me, we wouldn't be able to implement any policy. Let's look at the next slide. I put on this slide policies in different specific national contexts. And then now often like to look at the United Kingdom, the United States, and Pakistan as classic examples. Policies in different specific national contexts. In the United Kingdom, at the moment, if you look at issues affecting the country, most of the health problems are cardiovascular and respiratory diseases, number one. With heart problems, stroke, which are on top. We have issues of cancers, different cancers impacting the population in the UK. And then on the lesser note, we have an issue of obesity, which I've already mentioned, which are feeding into the cardiovascular issues. So you can see that all our policies are geared towards trying to solve these key health issues in the country. So government policies try to look at the issue of cancers, issue of cardiovascular diseases, and then looking at the issues of obesity, which is the major problem, which actually feed into the cancers as well as the cardiovascular and respiratory problems. Apart from that, one other area that the UK has written the policy on is smoking, which also feed into the cancer. So a year back, we have policies geared towards stopping smoking in the public areas and all areas. These are all policies that the NHS champion it to be able to protect the health of the population. Now, the issue of exercise is another one that fits into the policy. The more people exercise, the more they stay healthy. So the government is also encouraging physical activity. Gyms are spreading all over. Apart from that, another issue considered in the national policy in the UK is eating habits, where even right from the primary schools, people are not allowed to eat junk food, the type of food that should be eaten in schools. These are all policies. They are all healthcare policies. Right. So if you look at the UK, we can look at all these that I've mentioned, that are policies that are geared towards improving the health of the population. Right. Yeah.
Can I just say, I think you'll find that non-smoking, stopping people smoking, and effects of diabetes and obesity are all classed as public health policies, not NHS policies. The money comes from public health. Totally different.
Yeah. The health policies are implemented by the NHS. All policies will be implemented through the NHS.
Yeah, but it's not the same body. It's not the same auditing body or even writing body as the NHS. It's something totally different.
The
NHS department? It's it's a whole different department than the NHS. It's a department of the government. The NHS is healthcare.
Yeah, I know. If you look at the healthcare structure, we have the Department of Health on top, right? Money comes to the Department of Health from the treasuries.
Yes.
And then this money seeps through primary care and secondary care, which is the hospitals and the GP surgeries.
That's
because
right.
they are actually the implementing side of the policies. Right? So I agree with what you are saying.
But public health is funded aside from the NHS. It's nothing to do with the NHS funding. Public health, and they're the people that write the policies about helping people to stop smoking, helping people to stop eating, making sure people do exercise. They're all about prevention.
I purposely understand that. If you look at the NHS structure, we have 4 wings. One wing, when the money comes from the Department of Health, one side is the primary care and secondary care. And then the other side is public health. Then apart from public health, the other side is the monitoring and evaluation, where CQC comes in there. And then the last bit of the side is training and development. So the money goes through all these 4 routes. So what you're talking about is public health, right? They also help in implementing the policies. So the policies are not made by public health itself. It's a government policy. So if it is has to do with prevention, it goes through public health. If it has to deal with quality assurance, the regulatory bodies are there where CQC comes in. If it deals with training our consultants to be very effective, we've got training and development are there. And then we have a National Institute of Care Excellence. NICE guidelines, they also have their branch. They come in there.
Sorry, Elvis, if I can just interject here.
Okay.
Public Health England is an agency that was set up in 2013. It's nothing to do with NHS, although they interweave with each other. It is a totally separate agency. It isn't funded.
I understand that. I'm not saying that they are under NHS. They are all under the Department of Health.
It is not funded by the NHS. It is
it is not. No, I've never said it's funded by NHS. I said it's under the Department of Health.
Yes, it's from the Department of Health.
Public Health England is under the Department of Health. If you look at the structure of the healthcare in the
Department of Health and Social Care.
Yes.
The Government Department of Health and Social Care, they have the overriding control, but the control is then delegated out to public health, to the NHS and social care.
That's who Christina works for.
Because that's where I work.
Yeah, I understand that. I said, but they are all under the Department of Health.
We can't link that in with what the policies, their policies that are under the NHS, because we can't link them in because that's not the same.
What I'm saying is that the NHS is the implementation of the curative part. They deal with curing of the conditions that comes in. For prevention, it's public health. That does it, right?
And the care comes from social care.
Yeah.
And they all come from the Department of Health and Social Care.
No, Department of Health.
It's set to originally go for.
The Department of Health is the big elephant sitting down there. They receive money from the Treasury, and this money is divided part into the NHS, right? Part into public health.
Yes.
And then some goes into regulatory bodies like sick and the rest. And then we have the last bit, which is training and development. So the money goes to all these 4 areas. We got together, all of them help. All of them. So I'm not saying Public Health England is under NHS, no. They are all bodies that help implement government policies, right? So the Department of Health, the money comes in from the Treasury, part goes into primary care and secondary care, which is the curative part seep down through public health, right? Health prevention, health education, the rest, that goes in there. The other bit goes into regulatory organizations, which secrecy is the key over there. They look at policy control. Then apart from that, the other bit goes into training and development, training of nurses and staff and all the training materials that we have in the NHS. It goes in there. So there are 4 branches. And we also have NICE who provide the guidelines, right? So I'm not saying the public health is under NHS, no.
No,
right.
Okay.
But they are all organs that help in implementing government policies. So if the issue of stopping smoking and obesity is a problem, it's a public health issue. It's not something that could be cured. But if it's a cardiovascular disease that needs to be solved, then the NHS comes in there, right? So one is for prevention and one is for curing. And others is for monitoring, the secrecy and the rest. They are regulatory bodies. And then we have the training and development. So all these arms together help implement the policy in the country. Is that right?
Yes, so all the policies are actually written by the Department of Health and Social Care.
Right, yeah. Yeah. Okay. Are you happy with that?
Yeah, I'm happy with that.
Okay. So that is issues that affect a national context in the UK. So all our policies will be geared towards that. Problems of a country will determine the policy of a country. So if you are asked to write about the healthcare policy in the UK, then look at the problems that we have. If it is something that deals with curing, then of course it's the NHS, both primary and secondary. If it's preventative, then it's public health. If it's about quality control, monitoring and regulation that the right things are being done, then it's the regulators who do that work, which secrecy is keen. In terms of training and development, there is a different section altogether. So they are all under the Department of Health and Social Care. Good. I think I've made myself clear.
Okay.
Okay. Right. So that is the structure that we have in the UK to help implement policies. Now, in a developed country like Pakistan, they also, instead of Department of Health, they have what is called the Ministry of Health. And the Ministry of Health in India or Pakistan or in Nigeria, they are all ministries. They perform the same role, but they've got different names. That's the only difference. So they have the Ministry of Health with a Secretary of Health, as we have here, and they also have a public health, and then they have the primary care, secondary care, and tertiary care. In India and Nigeria, the rest, they have 3-tier system. They have primary care, and then they have the secondary care, and then we have tertiary care. And the tertiary ones are big specialized hospitals, and those that the medical schools are attached to. That is their structure. But in the UK here, it's based secondary care and primary care. Even though the secondary care has develop into where we have foundation trust and those that are not foundation trust, right? So they are all different, and they have different policies, and they adopt different approaches in the way that they work, right? So we have different policies in different national contexts. They use different approaches in different countries. So I've explained a bit about the UK and then the Pakistan. And the US system is a bit different from ours. It's a developed country. They also have a care at the primary level and then at the higher level. But I can say much about the UK. Right. So you will be required to choose another country apart from the UK to make a comparable study. So you try to read around other countries and see what they do. I'll give you a gist about what happens in Nigeria, India, and Pakistan, where they don't have the national health system as we have here, which is free. Of course, you pay. It's a mixture of both private and the public. Right. Let's go to the next slide. The social context of healthcare. The social context of healthcare. This is very important in terms of the comparisons that we will do with other countries. Right. Social context of healthcare. Healthcare is actually impacted by, number one, cultural and religious beliefs. It's impacted by education, the class structure, cultural and social factors, and priorities within the healthcare system. Let's look at cultural and religious belief. If you look at a country like, again, I will use Pakistan, because of their culture and religion, the healthcare delivery system actually reflects their culture. If you look at issues like breast cancer screening, it's got some sort of cultural and religious beliefs attached, where a male doctor is not allowed to take care of female patients, right? In terms of breast screening, they would like to have a female specialist to deal with them. So you could see that in terms of the delivery, it's all impacted by cultural belief. That is not very much like the UK. Of course, some people will decide that they are not comfortable with male consultants doing the screening for them, and they will prefer a female nurse is fine. You see, but it's so pronounced in other parts of the world. We've also got religious beliefs. What can be done and what cannot be done. I know of typical examples in the UK where, because of religious belief, people have died because they believe they are Jehovah's Witnesses and you don't have to go in for transfusion of blood, even though they need it. That is on a smaller scale as far as the UK is concerned. But if you look at other parts of the world, it's so pronounced. It could go beyond the issue of Jehovah's Witnesses, as we see here, which are minor cases where people's cultural belief will not allow them to accept some kind of treatment, and they might attribute some diseases, they might attribute it to spiritual influences, and they would like to have special deliverance and prayers to cure it. Those are all issues that impact on the healthcare delivery within different countries. I can only list an example of the Jehovah's Witness one in the UK. But in another part of the country, cultural belief is actually impacting on so many things. Sometimes even vaccination, people will not accept it because they feel that it's a way of trying to get to them. And even in the UK, I think there are sometimes stories about trying to attribute autism to some jabs that babies receive or not. So across cultures, across the world, cultural and religious beliefs actually impact on health care delivery. So when you are trying to describe the impact of culture, bring in such issues to differentiate what happens in the UK and what happens across the globe. Right. And then education has also got impact on healthcare delivery. In many developing countries, the level of education determines people's access of education and willingness to even go in for treatment. Of course, in the UK, literacy rate is very high. So an average person knows that if I have this problem, I have to go for scan, I have to go for treatment. But if you look at developing countries where people's education is quite low, there are tendencies for people to stay at home waiting for probably some traditional treatment, herbal medicine, and the rest. So before they get to the hospitals, they might be too late. So even in developing countries like Pakistan and the rest, you could also see that healthcare delivery within the population is impacted upon people's education. Of course, the elite are able to quickly understand symptoms and they can seek treatment in time compared to those who are not educated. So in education-wise, there are different ways that health services delivered to the population as a whole. Right. So when you are discussing or say try and get the balance, look at how education affects healthcare delivery in the UK and that of other parts of the world. The class structure. I don't think there is much of an issue with class structure in the UK. But again, if you look at Pakistan and India, when there is that caste system, where some people are the top caste, middle level caste, and the lower caste who are more or less liberals, and sometimes the lower caste don't even have access to so many things. It actually impacts of health on health service delivery in those countries. And the class structure is not much an issue in the UK, but even in the UK where everything is free, I think the upper class have more access and more chance of getting a good medical care because of their status, and then maybe in terms of their money in their pocket. So even the class structure, even though it's not pronounced in the UK, if you go to other parts of the world, it's very, very pronounced. And then we have cultural and social factors also impacting on health care delivery in the country. Again, we have issues that are typically cultural, people's attitude, and the way the society is organized. They all actually impact on the way health care is delivered. In fact, this cultural and social aspect is a bit related to the cultural and religious belief, as I've explained before. And then we have priorities within the healthcare. Again, I've touched on this. Different countries, different priorities. And that impact on where they pump their money and where they want public health to engage in education and make sure people receive the care that they demand. If you go to somewhere, again, like Zimbabwe, South Africa, their priority there is in health education on prevention of HIV/AIDS, getting medication, And then second issue might be malaria, how to control mosquitoes and how to get treatment for malaria. If it's research, it's all going into research into malaria and all those. So that is their priority. And I said, if you come to the UK, the priorities are also different. In terms of public health, as you said, public health priority will be on smoking cessation, physical activity, and all that. And if you go to the primary care, secondary care, emphasis is all on trying to support and helping with cardiovascular disease. They are all issues that are priority in the UK. So priorities among different countries differ, right? So healthcare priorities differ. So it's something that you have to have at the back of your mind. So you have to definitely do comparative studies to know what happens in the UK and what happens elsewhere in the world. Let's look at one. What about attitudes? Look at the impact, social context of healthcare, attitudes. What is the concept of what is health? Concept of illness, importance of health, attitudes to health and medical profession. These attitudes also impact on healthcare delivery system across the globe. And attitudes are different, right? Even the concept of what is health is different, right? In some developing countries, what someone can think is a health issue will not be in the health issue in the UK. Whereas people have enough to eat and feed, and they will not do any exercise, and see the issue of inactivity as a problem, and see the issue of obesity as a health issue. Somebody somewhere in Ghana or maybe in South Sudan wouldn't see the issue of obesity as a problem, because at the end of the day, the person is praying to get 3 square meals a day. So for them, if somebody is quite fat, it's not a health issue. It's a good life because it's got enough to eat, right? So the concept of depends upon what people's attitudes are towards what they think is actually health. And the same thing applies to the concept of illness. But in the general framework of the WHO, health is basically the idea of not the absence of disease or infirmity, but complete well-being of the individual, which is physical, spiritual, social, emotional health of the person. If it's a complete, then the person is healthy. That is the definition of the World Health Organization, right? That is the standard definition of what is health. But then people's attitude within different cultures, different countries, have different interpretation about what is health, right? So maybe you might think that somebody is healthy, is nicely dressed, going to work. You might see the red light, and the person is still crossing the road. That person is not healthy because maybe himself, mentally, the person might not be healthy. We have instances where people kill people. Knife crime, we just kill you. I mean, is that person healthy? What is going through the mind? So the concept of health depends on people's attitude, right? So as explained, using the case of South Sudan to explore this attitude, they wouldn't see somebody who is fat as unhealthy. No. To them, that person is healthy. It's a good life. Oh, this person has got pot belly. He's eating well. He's rich. That is the concept because of the attitude towards health and illness. And that attitude might be different in the UK. So the attitude of health and illness are concepts that are interpreted based on people's attitude. And then the importance of health is also influenced by people's attitude, right? The attitude towards life will cause you to see certain things as important. Maybe somebody with a signs of breathlessness might not see that any issue that has to do with health that might pose any threat to somebody living somewhere in South Sudan. Whereas somebody here in the UK might feel that is an issue that needs to be looked at. So it all depends upon people's attitudes towards it and attitude to health and medical profession. So the extent to which someone will rush quickly to go and say that, oh, I think this is a problem, I need to go, depends on people's attitude. And even within the UK context, people's attitudes are quite different. That is somebody in the Yorkshire, someone like Hall and the rest, their attitudes towards issue of health might be different from the attitude that someone in Manchester or south of England must would like to think in terms of what they think health is all about. That is why we have disparity in the incidence and prevalence of diseases across the UK, for instance. Right, let's look at the next slide. We'll finish very soon. It won't take much of our time today. We have got national context of health. And then we'll try and contrast cultural and social priorities with national and policy priorities. Right. As I said initially, health policy could be understood within individual national context. Right. So national priorities will determine the content of a health policy within a specific national context. So as an activity that I would like you to think about and do a bit of research about, take a country outside the UK. The UK, you are within the UK, so you are much grounded in the UK, you know what is going on in the UK. Choose a national context like the UK and find any other developing country of your choice. Look at their culture and look at their social priorities and then compare it with their national healthcare policy and look at the priorities of their policy guidelines. I'm giving you a gist of what is happening in the UK in terms of priorities. In public health, stop smoking and is there, increasing physical activity is there. They are all public health policies woven into the national healthcare policy in the UK. In terms of treatment, we have priorities on cardiovascular, stroke, and all that. So you are quite conversant with that. Let's look at the contents of other countries and compare. Look at the issue of culture in the UK. Look at that of any country of the choice that you can choose. Do a bit of research. Look at their national policy priorities. What is high on the agenda? I'm giving you a gist about something about South Africa, where the agenda was all on campaigns about HIV/AIDS, how to prevent it in the first place, and how to look at the issue of malaria and the rest as a priority, with a different priority here. So look at two different countries. Do a bit of research on your own, and then next time when we meet, we'll discuss it within the first 15 minutes and then go on from here. So this is an activity that I've set for you to look at your national context and other national contexts. Look at the cultural and social priorities within the national and policy framework and see where their priorities are, and then make a comparative analysis between what is in the UK and what is in other countries. And then that will feed into the assignment that we'll be doing. If you've got any question up to this point, please ask me before we draw the curtain on today's lecture.
No, that's fine. So next week you want me to do a discussion with you on the policy of another country compared to the policies we have on the topic in this country?
Yes, yes.
Okay.
That will help.
And can you send me these slides? Because obviously I haven't got any of these slides. This is not what I downloaded as part of this module at all.
Okay, I'm going to send it to your email. I've got your email.
Lovely, thank you.
Okay.
Because all the ones I've got are very different from this.
Okay.
I've got quite a few of them as well. I've printed them all up today.
Yeah. Okay. It's already on Moodle, but I'll email it to you straight away. Yeah.
Yeah. Well, it wasn't there today because ones I printed today, which is LO, 3.16 International Healthcare Policy, LO1.
Yeah.
Which I thought was today's session 1, understanding healthcare policy formation in the international context, is nothing like you just said.
Okay, no worries. I'll send it to you straight away, yeah?
Lovely, thank you.
All right, thanks so much for your time.
That's all right.
All right.
Bye for now.
Bye.